नमस्ते आदरणीय व्यक्तित्वहरू म रक्षा गिरीको तर्फबाट आज चाहिँ म नेशनल स्ट्र्याटेजिक प्लान टु इन ट्युबरक्लोसिस जुन चाहिँ 2021 25 26 सम्मको लागि रहेको छ 21 22 देखि 25 26 सम्मको लागि यो चाहिँ वाचन गर्न गइरहेको छु। सम्पूर्ण मैले यो अगाडिको भागहरुलाई स्किप गर्दै टेबल अफ कन्टेन्टमा यहाँले हेर्न सक्नुहुन्छ। ब्याकग्राउन्ड जसमा चाहिँ हेल्थ पोलिसी एन्ड हेल्थ प्लान, डेमोग्राफी, इकोनोमी, हेल्थ सिस्टम फाइनान्सिङ, नेशनल टिबी प्रोग्राम इन नेपाल, टिबी फाइनान्स, वाइ टिबी नेशनल स्ट्र्याटेजिक प्लान 2021 to 22 to 25 26, epidemiology of tuberculosis, estimated burden of TB in Nepal, TB notification, tuberculosis mortality लगायत यहाँले टेबल अफ कन्टेन्ट हेर्न सक्नुहुन्छ। ब्याकग्राउन्ड Health policy and health plan. The section 35(1) of Constitution of Nepal has guaranteed the right to free basic health services to every citizen of Nepal and has stated that no one shall be deprived of emergency health care services. Likewise, the National Health Policy 2019 has the provision for implementation of effective program to execute research, oversight, prevention, control and eradication of communicable disease including tuberculosis, HIV/AIDS and malaria. Furthermore, the Public Health Service Act 2018 states that every citizen shall have a right to get emergency health services and easy access to quality health services in an equitable manner. The Act has provided the Ministry of Health and Population the right to formulate necessary directives subject to the implementation of provision or act formed under this Act. On the other hand, the 15th plan fiscal year 2019-20, 23-24 has included TB as a communicable disease and has planned for increasing the investment for the diagnosis of TB and other infectious disease and toward the management of a special program for prevention of TB and non-communicable diseases. Keeping all these aspects in mind, the 5-year National Strategic Plan to End Tuberculosis in Nepal 2021 to 22 and 25-26 has been formulated. Demography. The projection done on the basis of National Population and Housing Census 2011 estimated that population of Nepal in 2020 to be 2,99,96,478 approximately, according to the prevalence of TB survey carried out in 2018-19. The incidence of TB is estimated to be 245 per lakh population. Therefore, the projection based on the population estimate that around 69,000 people with TB disease are living in Nepal, out of which 67% are expected to be male and 33% to be female. TB is one of the top 10 causes of death in Nepal. It is estimated that about 17,000 people die due to TB every year in Nepal. Since there is a huge difference between the target of identifying new TB cases and the current data on health management information section, HMIS 27,745 in 2019-20, there is a need to identify new TB cases and bring them within the continuum of treatment. Economy. Nepal Officially, the Federal Democratic Republic of Nepal is the least developed landlocked country that has adopted mixed economy system. In 2018-19, the economic growth rate of Nepal was 6.8%, but due to the COVID-19 pandemic, the country suffered a negative growth and with outstanding debate of 1.9. The revised estimation suggests that the economic growth rate of the country will increase up to 2.9% in 2020-21. The 15th plan has estimated the economic growth rate of Nepal in 2021-22 to be 9.9%. Similarly, the per capita income that is regarded as an indicator of economic development was $1,126 in 2019-20. By the end of 2020-21, the per capita income is projected to be $1,191. In Nepal, the percentage of people living under poverty is 18.7% and 28.6% of Nepal population is multidimensionally poor. TB and economy are interrelated, hence it is necessary to include activity that maintain social security in TB plan and implement them accordingly. Source: 15th Plan, Fiscal Year 2019-20, 23-24 and Economic Survey 2019-20. Health system financing. The total health expenditure as a proportion of GDP has been steadily increasing in Nepal. Health care has been predominantly financed by out-of-pocket payment. According to a study carried out in 2014-15, 60.4% of total health expenditure was covered by OPP, out-of-pocket payment. Beside OP, health expenditure in Nepal was much higher than less than 25% benchmark set by WHO. The government financed health insurance program that began in 2016 has been scaled up in 68 districts. Under this scheme, a family with up to 5 members has to pay premium of Rs 3,500 annually and avail free medical treatment or Rs 1 lakh in total. The Health Insurance Regulation 2018 has the provision for 100% subsidy by the government to the families of handicapped people with a disability and people affected by leprosy, HIV and MDR-TB. National TB Program in Nepal. National TB Control Center is one of the centers within the organizational structure of Ministry of Health and Population and is the focal point of National Tuberculosis Program. It is responsible for formulating policy, strategy and plan and carrying out monitoring, evaluation and quality assurance of NTB. NTB is fully integrated and being implemented within the health system of the Government of Nepal through 135 public hospitals, 2,168 non-governmental organizations, 196 primary healthcare center, 3,806 health posts and 51,420 female community health volunteer. Annual Report 2018-19. TB Finance. Of the total budget allocated NTB from 2015 to 16 to 2019-20, the proportion of government budget was 53.16%, while 46.84% budget constitute the fund donated by donor agencies. While TB services are provided for free, patients do bear charges for undertaking X-ray along with other laboratories fee. Patients also pay for their ancillary drug and bear indirect cost for diagnosis and treatment of TB, leading to substantial OOP. Government of Nepal and ADP's expenditure. Why TB National Strategic Plan 2021-22 to 25-26. Since 1994-95, National TB Program has been formulating short-term and long-term plan and has been implementing program accordingly. The TB program has been under implementation in line with the global and national guidance. Since the prevailing strategic plan 2016-17 to 2021 ends in 2021, the NTP has formulated the National Strategic Plan to end tuberculosis in Nepal to 2021-22 to 25-26 by addressing the topic mentioned below. Implement NTP effectively is for the spirit of federalism, fulfill the commitment made by the Government of Nepal at the global and regional level to our meeting the NTP target. Until 2017-18, the number of TB incidence cases were expected to beat 42,000. However, the result of National Tuberculosis Prevalence Survey carried out in 2018-19 estimated 69,000 new cases of TB, which is 1.6 times higher than previously estimated. Therefore, it is of utmost importance to utilize more effective technology for diagnosis of TB in order to end TB. In the process of formulating this strategic plan, extensive country-level dialogue and discussion have been conducted with the expert different group policymakers from the local to the central level by forming technical advisory committee and various other committee on different trade. The strategic plan has included the suggestion received from such in-depth discussion along with the recommendation received from the joint program monitoring and evaluation carried out by national and international experts in 2018-19. The strategic plan has been developed to be used as a policy to guide the provincial and local level government as well. The role and responsibility of the federal, provincial and local level are described in section 5. Epidemiology of tuberculosis. Estimated burden of TB in Nepal. TB burden in Nepal, prevalence and incidence is higher than previously estimated. As per National Tuberculosis Prevalence Survey 2019 17-18, the TB prevalence rate is 416 per lakh, which is 8 times higher than previously estimated by WHO, and revised incident rate is 245 per lakh, which is 1.6 times higher than previously estimated. The mortality rate associated with TB were also estimated to be 3.1 times higher than previously estimated, while TB drug resistance is 1.6 times higher than the previous estimation. Hence, Nepal has been enlisted in WHO bulletin as a country having high resistance to our TB drug. Estimated burden of TB fiscal years 2017-18 incident 245 per lakh, prevalence 416 per lakh, mortality 9,000 to 26,000, DRTB total estimated 2,200. Prior estimate is 151 incidence, 215 prevalence, 3,900 to 7,400 annual mortality, and 1,400 annual DR total estimate. Revised burden higher by incidence 1.6 times, prevalence 1.8 times, mortality 3.1 times, and DRTB 1.57 times. TB notification. The number of new relapsed TB cases notified was 32,043 in 2018-19. Notification rate of new TB cases in Nepal differs substantially by geographical area. TB notification rate were found to be lowest in the mountain area to the north of the country and highest in the tri-plain in south. Considering the ratio of new incidence and prevalence rate, it is imperative to bring 14% TB cases within the continuum of treatment. Tuberculosis mortality. Although there is no functional vital registration system in Nepal that provides direct or real-time information about TB related death, data on TB related death have been estimated based on TB prevalence survey and the data provided by WHO, which is 58 per lakh population annually. Progress, problem, challenges and recommendation. Key achievement. Due to lack of human and financial resources, only 48% of the activity proposed in National Strategic Plan 16-17 to 2021 have been implemented and 17% are partially implemented, while 36% activities have not been implemented. Source: Joint Monitoring Team Report 2018-19. The major achievement during this period are as follows. DSTB is included in package of basic health services, and the patient with DRTB are covered by National Health Insurance Scheme. The NTP have moved to our digitalized case-based surveillance. WHO recommended MWRD has been expanded to 43 districts. Cultural DST laboratories has been established in 2 places. The service of transporting sputum to TB diagnostic center and need-based referral system have been initiated. Work is underway to produce the medicine for all form of TB by the government of Nepal. Fast, find actively, separating and treating effectively approach has been launched to increase TB diagnosis among the service recipient at the hospital and prevention of TB. To appropriately manage TB among children after diagnosing it, partnership with Nepal Pediatric Association, professional authority and other stakeholders has been established. Furthermore, the capacity of doctors working in various parts of the country have been enhanced. As a result, the TB diagnosis rate among children has been increased. There has been increment in HIV testing rate among the TB patients. Hospitals are being constructed for specialized treatment service for TB at the central level, and guidelines for the treatment establishment and operation of TB treatment and referral management center at the provincial level have been implemented. The treatment success rate of DS TB patient is 90% and the treatment success rate of drug resistant TB patient is 70%. In addition, there has been tremendous increment in the treatment success rate of DRTB with the introduction of new and shorter regimen of TB treatment. Key problems: case notification not being mandatory in terms of health agenda, investment, leadership and good governance, TB program not being included as a priority program at all levels. The depth of adequate engagement and participation of CSO, CBO and patient support system in TB program. Sputum collection and its transportation to nearest diagnostic center is still not being effective and not being available nationwide. Inadequate effort in carrying out sputum test with the use of recently available gene export and its underuse. Ultimately, an inadequate reporting and recording of TB program by all health service providing facility. Health facility based treatment service not being easily accessible to the patient. Lack of proper implementation of CB doors through it has been launched in some districts. Ineffective partnership with private sector and other institution and stakeholder. COVID-19 infection and added complexity in TB program. Key challenges: to improve accountability, prioritize engagement and investment for TB program at all levels, to enhance the work efficiency of TB focal persons, TB is to strengthen meaningful participation of community and private sector in TB diagnosis and treatment, expansion of newer technology and its maximum utilization for TB diagnosis, expansion and maximum utilization of sputum collection and transportation method, effective expansion of laboratory for TB diagnosis and its appropriate management, institutionalization and expansion of electronic case-based surveillance system in both public and private sector, and institutionalization of robust supervision system. Increment in investment and effective implementation of TB infection control measure at all levels. Implementation of TB program by integrating it with other national health program related to HIV, IMNC, tobacco control, diabetes, nutrition, women of reproductive age group, recently delivered women, pregnant women, infant and adolescents health, etc. Lack of designated person to implement TB program at local level. To implement TB program in multi-sectoral approach, education, agriculture, finance, social security, employment, poverty reduction, etc. To identify patients diagnosed with TB but are unenrolled in TB treatment and bring them in continuum of TB treatment and care. Management of TB patients during pandemic like COVID-19 and ensure continuation of such services. Key opportunity: to secure commitment from the political leadership to on ending TB, leverage economic and technical support from donor agency, implementation of TB program by provincial level and local level with the investment of their own resources, establishment of patient center services for TB management, increment in advocacy and support and engagement of community and private health institutions in TB program, connect sputum collection and transportation with the TB diagnostic center, and the possibility of participation of provincial public health laboratory for ensuring the quality, conducive environment for utilization of knowledge and experience gained during the implementation of COVID-19 control program, capacity building of health worker at all levels. National Strategic Plan to End Tuberculosis 2021-22 to 25-26. Vision, goal and objective. Vision: TB-free Nepal. Goal: Nepal has set a goal to decrease the incidence rate from 238 in 2021 to 181 per lakh population by 25-26, decrease mortality rate from 58 in 2021 to 23 per lakh by 2020-21 in TB epidemic by 2035, eliminate TB by 2050 and reduce the catastrophic cost to zero. Objective: to build and strengthen political commitment, sustainability and patient-friendly health system to end TB, to ensure the identification of TB diagnosis, quality treatment and prevention. Strategy, policy, action and major activities. Mentioned below are strategies that will be adopted to meet the objective of the strategic plan. You can see the list strategy to improve the quality of TB services and strengthen the health system for universal access to TB services, effectively evacuate the TB services and support by increasing the community engagement in TB management and strengthen the digitalized case-based surveillance system in healthcare facility. Policy action: provide quality TB service through increased universal access to healthcare by further strengthening the health system of TB program. Major activity: incorporate standard TB services as a part of basic health services package within the universal health coverage and ensure no catastrophic cost occur to TB patient and family member. Management of adequate and sustainable resources for TB program is per the need. Strengthen the health system in line with federalism and management of post is per the need. Strengthen the capacity of health worker, redefine partnership at all level, ensure effective procurement and supply chain management system. Strengthen community involvement and ownership in TB Free Nepal campaign. Implement the TB Free local level declaration campaign by involving all individuals holding leadership position at all level and the community to ensure necessary capacity and adequate resources for TB care and prevention. Formulation of microplan and implementation of multi-sectoral concept. Improvisation of health facility based services. Expand the CB DORS program for the DSTB and DRTB in phased manner by adopting appropriate method on the basis of detailed evaluation. Implement activity of active case finding up to the community level for TB case active case finding, diagnosis and timely treatment. Strengthen monitoring system of TB program. Strengthen and revise the mechanism of program review, analysis, support at all level. Ensure the quality of TB data in collaboration and with communication system within Ministry of Health and Population. Collaborate and coordinate with the MOFGA Amofaga to record the TB related data in vital station system. Use the digital platform between TB program and HMIS to strengthen the TB surveillance system. Ensure the enabling environment for implementation of suggestion and recommendation by strengthening the supportive supervision, monitoring and evaluation mechanism at all level. Formulation of evidence-based plan and promotion of periodic review and research. Ensure 1.4 ensure implementation of TB program through integrated health system for its sustainability during natural disaster and other emergency. Access to basic health service for TB patient will be ensured even during natural disaster and other epidemic period. Strategy 2: strengthen laboratory services to further improve the management of TB diagnosis and treatment. Strengthen TB laboratory services. Major activity: formulate national TB laboratory plan and implement it. Strengthen the national TB reference laboratories, national TB control center. Establish examination of genotypic DST for first and second line TB medicine at all laboratories affiliated under the NTRL. Strengthen MWRD laboratory network. Reorganize a quality assurance smear microscopy network. Involve provincial public health laboratories for quality assurance of MWRD and microscopy center. Establish the sputum collection and transportation SCT system and strengthen the sputum courier mechanism. Establish a system to evaluate the quality of laboratories. Ensure timely procurement and maintenance of laboratory equipment and consumables. Third number strategy: quality improvement of the service for TB prevention, identification and treatment. 3.1 increased rate in identification of patient of DSTB and DRTB. Strengthen TB case in community and health facility using the modern technology, digital X-ray, MWRD. Strengthen of contact tracing to carry out sputum test of people who have come in close contact with TB patient. Scale of activity of active case finding among high risk and vulnerable group. Strengthen TB referral and treatment mechanism by adopting innovative approaches to prevent initial loss to treatment and follow-up of TB cases. Strengthen the management of diagnosis and treatment of childhood TB. Increase TB treatment success rate. The quality improvement in TB treatment in all the health facility. Quality check and regulation of new regimen used in TB treatment and initiate and expand across the nation. Provide psychological and support to TB patients and their family for addressing the barrier to treatment adherence. Strengthen DSM mechanism, drug safety monitoring and management for efficient identification and effective management of adverse reaction caused by medicine used in the treatment of RR-MDR-TB. Being the TB patient on register in treatment despite diagnosis in laboratories. Strategy, Policy Action 3.3, expand TPT coverage and strengthen infection control measure at all health facility. Major activity, expansion of TPT and infection control program will be expanded only through appropriate study and evidence. Increase coverage of TPT among the children less than 5 years and PLSIB and scale of among other TB contact and vulnerable population. Expansion of TB prevention and diagnosis technology and TB medicine only by being based on study and evidence. Strengthen infection control and prevention measure. Implementation of multi-sectoral approach and addressing of high risk due to TB comorbidities. Strengthen TB HIV cooperation. Collaborate with TB control program under the non-communicable disease for joint effort for TB control program. Establish coordination between anti-TB and diabetics program. Increase TB case finding program among people with malnutrition. Focus on promotion and intake of nutritious food among the TB patient and their family. Ensure meaningful participation of private and non-governmental sector for effective management of TB services. It's a policy action in 3.5. Develop a package for morbidity, adequate investment and service expansion in private and non-government sector to strengthen the patient pathway. Develop partnership with relevant stakeholder, medical college, private health facility, etc. to effectively manage TB service. Formulate a supportive policy and legal framework. Utilize digital technology for reporting and building accountability. Key responsibility, federal. The National TB Control Center will perform following role on priority at the federal level for the implementation of the strategic plan. Incorporate standard TB service as a part of basic health service package within universal health coverage and ensure no catastrophic cost occur to TB patient and family member. Advocate for the political commitment for securing adequate and sustainable resources and comorbidities for TB program. Commodities for TB program. Advocate for health system strengthening and adequate human resources in line with the federal context. Redefine NTP partnership at all levels. Ensure effective procurement and supply chain. Ensure effective procurement and supply chain system in place. Strengthen and improvise the program review, analysis and feedback mechanism at all levels. Ensure TB data quality in collaboration with information system of Ministry of Health and Population. Collaborate and coordinate with FAGMO FAGA to strengthen vital registration system. Use digital platform between NTP and HMIS to improve the TB surveillance system. Promote periodic review and research for evidence plus plan. Ensure the inclusion of TB prevention and care activities in disaster preparedness plan at all levels. Execute the National TB Laboratory Plan. Strengthen anti-RL and under NTCC. Establish line probe assay LPA laboratory network under anti-LR. Establish DAM network monitoring system. Ensure procurement and maintenance of laboratory equipment and necessary regimen. Strengthen childhood TB diagnosis and management. Develop a package for mobility, adequate investment and service expansion in private and non-governmental sector to strengthen the patient pathway. Formulate supportive policy and regulatory framework. Collaborate with TB control program under non-communicable disease for joint effort for TB control program. Establish coordination between anti-TB and diabetic program. Initiated new diagnosis and regimen for TB prevention therapy along with monitoring and evaluation. Initiate and expand the quality checking and regulation of new regimen of TB treatment province. For the implementation of this plan, following activity will be performed by Provincial Health Director under Ministry of Social Development in coordination with NTCC. Capacity building of health worker. Implementation of TB-free local level declaration campaign by involving all individual holding leadership position at all level and the community to ensure necessary capacity and adequate resources for TB care and prevention and formulation of microplan. Expand CB DOTS program for DSTB and DRTB. Strengthen and improvise the program review, analysis and feedback mechanism at all levels. Promote periodic review and research for evidence-based programming. Ensure the inclusion of TB prevention and care activities in disaster preparedness plan. Strengthen MWRD laboratory network that is operated in a planned and continued manner. Management of quality assured Smear microscopy network, make provincial level public health laboratory responsible for quality assurance of MWRD and microscopy center, develop laboratory network monitoring system, ensure procurement and maintenance of equipment and necessary material, strengthen the management of childhood TB diagnosis and treatment, monitoring and evaluation of diagnosis and regimen of TB preventive therapy. Local level. For the implementation of this plan, the local level will implement the following rule with priority in coordination with provincial government and NTCC and facilitate and provide support to health facility, capacity building of health worker, implementation of TB-free local level declaration campaign by involving all individuals holding leadership position at all level and the community to ensure necessary capacity and adequate resources for TB care and prevention and formulation of microplan, expand CB-DOTS program for DSTB and DRTB, strengthen and improvise the program review, analysis and feedback mechanism, ensure the inclusion of TB prevention and care activity in disaster preparedness plan, establish of courier system for sputum collection and transportation, strengthen the activity of TB case identification at health facility by utilizing sensitive screening and diagnostic tool, strengthen the contact tracing of people who have come in close contact with TB patient, scale of systematic scanning among high risk and vulnerable group, strengthen TB referral mechanism by using innovative approaches to prevent initial loss to follow-up of TB cases, strengthen the management of childhood TB diagnosis and treatment, partner with intermediary agency, key stakeholder, medical college, private health services center and effectively manage TB services, utilize digital technology for reporting and developing accountability, expansion of collaboration with TB HIV program, increase TB case identification program among people suffering from malnutrition, increase coverage of TB among eligible children under 5 years and PLHIV and scale up among other TB contact and vulnerable population, strengthen infection prevention and control mechanism, ensure quality treatment of DSTB and DRTB in health center, provide psychological and support to TB patients and their families for addressing their barrier to treatment adherence, strengthen and expand DSM mechanism, drug safety monitoring and management for efficient identification and effective management of side effect of medicine, discourage the tendency for not reporting of TB cases following diagnosis and the obstruction that are likely to occur following effective monitoring, structural management, monitoring and evaluation. The government agency, non-government organization, donor and partner organization involved in the NTP will be involved in regular monitoring of the progress in the implementation of a strategic plan. The concerned office will monitor the program implemented by the bodies operational under its preview. The concerned ministry, Department of Health Service, NTCC, provincial government, local level government and other associated authority will involve in monitoring activity. To monitoring the overall implementation status of this strategic plan, the NTCC at the federal level, the provincial director at the provincial level and the concerned local level government at the local level will form a monitoring committee with the involvement of all stakeholders. The monitoring committee will regularly monitoring the non-performance of the prescribed work and submit a report to NTCC. To implement the strategic plan or detailed monitoring and evaluation plan, M&A plan will be prepared and implemented. The effect and result of NTP will be evaluated internally and externally. For independent evaluation, the NTCC will form an evaluation task force comprising of national and international experts. The task force will submit a report to Government of Nepal after conducting a mid-term evaluation of the program implementation and final evaluation of the result and impact. Legal provision. By being based on the duty and function of federal, provincial and local level as per the Constitution provision, the Public Health Service Act 2018, National Health Policy 2019 and Public Health Service Regulation 2020, prevailing 15 Plan Basic Health Service Package 2018 will be effectively implemented to legally regulate and manage TB related activity of all the three levels of governments. Prevailing national strategic plan has included TB diagnosis, treatment and care as free of cost services. The use of modern information technology will be promoted in the legal system in order to ensure free diagnosis and treatment of all type of TB patient. Though health insurance, free insurance will be provided to all type of the TB patient by amending the Health Insurance Policy Act and Regulation is required. Provision of making the public and private health institution compulsorily report to HMS will be ensured by amending the Infectious Disease Act 2020. Human resource management. For the implementation of the recommendation provided by joint monitoring team comprising of national and international experts, following arrangement will be made to address the existing problem related to human resource management on the basis of strategic plan of human resource for health 2021 to 3031, organization and management survey, O&M survey, institutional arrangement of all level of government, federal level, national TB control center. In order to implement the strategic plan, it is necessary to increase the existing manpower at National Tuberculosis Control Center from 22 to 55. The approved organizational structure of National Tuberculosis Control Center has the provision for 33 staffs, of which 22 are technical staff while 4 posts are current backend. And DCC has been receiving support from 8 technical staff supported by Global Fund in its program management unit, and this assistance will be continued until the implementation of this strategic plan. In order to effectively implement the activity mentioned in the plan, 12 more technical staff are required, which are proposed to be sanctioned by the Government of Nepal. These proposed posts are also included in the strategic plan of human resources 2021 to 3031 formulated by Ministry of Health and Population. For successful implementation of this plan, it is imperative to adjust the existing position as per number of position tabulated below. We can see various type of position here. We can see various type of position here. Public Health Administrator 19, Nepal Health PHE, subgroup 0, existing 0, 8-1, proposed post. You can see other public health inspector and public health officer. Province, district and local level. Currently there are problems in the implementation of the TB program as there are no staff assigned for TB program at the province, district and local level. Therefore, a strategic plan will be implemented at the province, district and local level by adding the following posts. Medical Surveillance Officer 7, Public Health Officer level 7, proposed net position 77. Public Health Nurse, Health Assistant 753. For the successful implementation of a strategic plan, technical assistance can be obtained on the need basis from the supporting organization in addition to human resource mentioned in the table. Detailed human resource detail for TB program will be included in the human resource management plan. Financial landscape. For the implementation of this plan, a total of $192 million is expected to be spent in the 5-year period. A large portion of the budget will be spent on TB case identification, management of DRTB, procurement of medicine and laboratory related equipment and material, as well as program management and monitoring. These include increased use of gene export, laboratory services with culture in each province and establishment of referral center. Management of DRTB is yet another area requiring huge investment is the expenses on TB treatment and expensive medicine will increase continuously. Program management and monitoring also include upgrading of treatment center and drug store. Community participation and training are another area that require more investment. As there is a need to improve the performance of employee, expenses have been provisionized for the training. The budget for the this NSP has been prepared on the basis of activity proposed during the country dialogue, multi-stakeholder meeting, focus group discussion and interaction with local community and patient and target group that took place in different phases. It has been prepared also on the basis of suggestion and recommendation received from the joint program monitoring carried out by national and international experts. The budget required for the plan has been estimated on the basis of norm, historical cost, current price, cost and epidemiological data. Data directed is the part of the directive of program implementation guideline of Government of Nepal. Out of total cost of NSP $192 million, the government of Nepal has committed to invest $81 million, while the Global Fund has committed $21 million for 2021 22 to 23-24. In addition to this, it is estimated to receive additional $14 million from the Global Fund in the same ratio for the next 2 fiscal years. The remaining fund $76 million is expected to be collected from the other donor agencies such as USAID, KNCB, LSL, International TB, RIS, JICA and PATH. The budget has been proposed for the program to be integrated into the integrated health system for the proper management of TB program in time of disaster. The total budget for this National Strategic Plan 21-22, 25-26 will be as mentioned below. Total expenditure for TB control. We can see the different budget, total source budget. Total expenditure for TB control, Government of Nepal, donor agency, expected viability, funding gap, risk analysis and mitigation measures. To implement this strategic plan, mitigation measures have been prepared by analyzing the risks mentioned below. Internal is Nepal, it is a risk of various natural disasters such as earthquake, landslide, epidemic disease. Health service including tuberculosis may be affected due to obstruction in transport and communication system. Equal participation of all 3 levels of government as well as the utilization of local resources has been expected in the implementation of this strategic plan. Without adequate support, it may be difficult to achieve the expected result of this strategic plan. The proposed human resources are not available. It will be difficult to implement the proposed plan. While preparing the plan, it is estimated that activity will be implemented keeping in view the political stability of the country. If there is no stability, the goals may not be achieved as expected. As external, it is estimated that more than half of the estimated cost for implementing the activity of the plan will be received from external sources. If the sources are not available, there is a risk of not meeting the expected result due to the difficulties in the implementation of plan activities. Is the support from the international TB expert are also expected in the implementation of the plan. There will be difficulty in achieving the goal in the unavailability of such assistance. Mitigation measure internal in order to ensure the continuity of TB services during disaster and epidemic. TB will be included in disaster management plan, and clear blueprint for disaster and epidemic mitigation activity will be formulated and implemented. In order to increase the participation of local level in the implementation of the plan and to ensure the availability of necessary resources, the activity of the Tuberculosis Free Nepal campaign will be conducted by making a detailed plan. Emphasis will be laid on the management of necessary resources by forming in TB committee under the chairmanship of Honorable Prime Minister at the federal level and Honorable Chief Minister at the state level and Mayor at the local level. A time-relevant interim plan will be formulated and implemented to continue the TB diagnosis and treatment services. External effort will be implemented to secure support from donor agency by undertaking coordination meeting, advocacy and debate. If these result into being unsuccessful, effort will be made to invest internal resources with priority for the implementation of the plan. Along with this plan, technical assistance plan will also be prepared and submitted to the concerned body to ensure the necessary assistance during the implementation of the plan. Quality assurance. The following activity will be implemented for quality assurance during the implementation of this strategic plan. Arrangement will be made for the process of providing and receiving feedback by making the record and reporting system efficient. TB program will be reviewed annually in the framework of multilateral accountability at all levels. Regular and collaborative monitoring and supervision will be made using the checklist and of quality checking from all levels. Regular cohort analysis, planning and review meeting will be held at all levels for evaluation and providing feedback on the program indicator. The quality data will be ensured regularly and annually. The program will be evaluated annually by external reviewer. Joint monitoring team, internal and external and expert, will carry out the independent review of NTP once in every 5 years. Review of the regional green light committee. The national drug resistant tuberculosis program will be reviewed annually by international expert. Regional and global institutional drug review. The national drug procurement and supply management system will be examined annually by international expert. Annual testing and certification of national tuberculosis laboratory will be done by supranational tuberculosis laboratory. Similarly, National Tuberculosis Reference Laboratory will be ensure and certify the quality of provincial level TB laboratory. The quality control of microscopic center will be done by the provincial public health laboratory. Indicator of National Strategic Plan to end tuberculosis in Nepal. Strategies. Indicator of National Strategic Plan to end tuberculosis in Nepal. Strategy: improve the quality of TB service and strengthen the health system for universal access to TB service. Evacuate the TB service and support by increasing the community engagement in TB management and strengthen the digitalized case-based surveillance system in healthcare facility. Family affected by catastrophic cost due to TB is equal to 0%. Baseline indicator unavailable, baseline year unavailable. In Nepal, a survey on catastrophic cost has not been conducted, hence this indicator will be 0 during the period of a strategic plan. Other indicators are increased government investment on TB program. Baseline indicator 35%, 25, 26, 70%. Community will support in the treatment of 50% of TB patients. Unavailable, inline 50%. All health facility 100% reported patient detail through electronic system unavailable, and the inline 100%. Strengthen laboratory services to further improve the management of TB diagnosis and treatment. DST for patient with TB 40% in baseline and 100% will be in inline. 95% of patients with the DSTB patient are identified and brought within the continuum of care. 46% and will be increased in 95% inline. 95% patients with DRTB are identified and brought within the continuum of treatment. 18% and it will be 95% in line. TB case notification contributed by 30% of private sector are now 17% in baseline and 30% will be in the inline. All 100% TB patients are tested for SIV, now 69% in baseline and 100% will be in the inline. Decrease the incident rate per 1 lakh population, 238 in baseline and 181 in line, which is reduced by 24%. The quality improvement of services for TB prevention, identification and treatment. Increase access to latent TB infection treatment by more than 90% among children under 5 years and PLSIB baseline 40%, inline will be 90%. Treatment success rate of DSTB reached more than 90% and it will be continue at 90%. Treatment success rate of DRTB to be more than 85%, 67%, 85%. Decreased TB mortality rate 58 per lakh, 223 per lakh, reduced by 60%. And we are at the end of the National Strategic Plan of Tuberculosis. Thank you for all hearing me, and if you have any comment and suggestion, please write below in the comment section, and thank you.